You're watching the Wellness Hour Live. I'm Randy Alvarez. We're talking about pain management, what you need to know. When should you consider using a pain management physician, a board-certified pain management physician? With us, we have one of the busiest pain management physicians here in California, Dr. Roland Reinhart. Dr. Reinhart, welcome to the program.
Well, thank you.
Now, you have a huge center in Rancho Mirage, California. And so for people that don't know you, and we're going to talk about pain management today, tell us a little bit about your practice, your typical patient, what are the different procedures you do?
Right. Well, we have a practice that basically we treat any kind of pain. So whether it's sports injuries, orthopedics, cancer pain, just really any type of pain you have, and typically chronic pain. So,
Okay.
you know, people who have chronic pain, that's pain that's lasted for more than 6 months, actually those people are sensing pain differently, and you need a specialist to treat that, because it's not like just spraining your ankle and, you know, take some aspirin and that's it. So there's actually a change that occurs in the spinal cord and signaling to the brain, and so you need a person who specializes in treating chronic pain problems.
Okay. Now, so how does somebody get to see a person like you? So they go through their primary care physician usually, or the orthopedic surgeon.
Frequently.
Tell me about that.
Yeah, frequently it's a referral-based thing. I mean, frequently our patients are referred if the patient maybe was started on some painkillers and maybe they escalated the number of painkillers and they're getting a little uncomfortable with that. And a number of patients come to us that way. But we also do have patients who come directly to our office.
And insurance covers what you do.
It does.
Et cetera.
Absolutely.
Okay.
Absolutely.
Now, we should mention, you do a lot of the procedures. What are the specific procedures? I mean, you do implantable devices, you do some surgical procedures.
In our practice, we cover the gamut of everything. So we, you know, some patients, if you have whole body pain, maybe you need pain medicine. But typically, pain medicine today, or pain management today, is trying to get to the focused, localized pain generator, figure out what that is, treat that, rather than give the patient just pills. So again, there's
Interesting. I thought it was the other way around. That you go to a pain management physician this is the expert on the medications.
Well,
even though that's true, but you're saying that your goal is to.
The goal, if you have localized pain, there's something that's causing that. And so if you can figure out what that is, and again, the technology is much better for figuring out what that is, then there are specific treatments that can be applied to that to eliminate that pain. So my background before being boarded in pain management, I'm also boarded in anesthesia, and anesthesia is, you know, eliminating pain for surgery.
While you're asleep.
Right. So here, though, we want the patient to stay awake, but to eliminate the painful source. And so using medications is usually reserved for cases maybe where you have whole body pain or something else. And frequently narcotics are not particularly helpful with certain types of pain. So again, going to a specialist in pain management, and again, board certification is a good indicator that they have that background and knowledge that they can deal with the pain problem.
So you do epidurals, you do.
Right. So as far as procedures, we do injections. Epidurals are treatments for the spine, injections into joints. Sometimes with joints you can destroy nerves. You do rhizotomies. We also implant spinal cord stimulators. It's a way to basically change the signal going to the brain, tell the brain that the pain isn't there. It's more of a tingly, warm feeling. Also implantable devices that deliver narcotic medications to the spine. And some of the newer procedures, such as kyphoplasty, where we're restoring bone height, or a newest procedure maybe is a mild procedure, where we actually are making the spinal canal a little bit opener so that we can alleviate the pain from spinal stenosis.
Okay. Now, you believe that there are, especially across the U.S., millions, probably 20 million Americans maybe, that are in pain that don't have to be.
Well, the number one
And they're
reason,
afraid of medication. They're afraid of going to a doctor like you.
Well, hopefully they're not afraid of going
Well,
to a
no,
doctor
I mean, if
like
they're in
me.
pain and they don't have to be, there's something that's keeping them from going
Well,
in.
there's a number of barriers. Sometimes patients are afraid that they're going to be on narcotics, or they maybe have narcotics, so, but they may be concerned. Their doctor may be concerned if they're on narcotics.
Okay.
And so there's a number of different barriers, concerns about that. And again, narcotics are not really what we're all about in terms of pain management. So that's probably the
So there's
the
a
least
lot of
of the
people
fear.
in pain that with some of these injections could be out of pain.
Well, that's true, and the number one reason for people to go to doctors is pain, and pain is the number one reason for disability and lost days at work and lost production and so on. So getting treated early is typically better than waiting for a long period of time. And again, over a period of time, the way that pain is signaled in the spinal cord and brain changes, and so it's important to, even if you've had pain then for a long period of time, to make sure that you get treated in the most appropriate way.
Are there stubborn people, probably men in particular, right, that they're in pain for 5 years and they go to you, and have you ever seen cases where a simple procedure, injection, they're out of pain? And they go, I should have done this years ago?
You do see that. Or you see people who maybe are not so miserable, but you give them an injection and they say, wow, I feel, better than I have in 10 years. And they scratch their head as to, well, I guess I should have gone before. And sometimes a fear of an injection is,
good point. So is there that
keeps
fear?
them away.
It's pretty big?
Yeah, absolutely.
Does it hurt? I mean, it must hurt. Well, do you numb the area, or you don't have to numb it?
Yeah, we typically numb the area. And so, some people, that I respect very well, will actually give them anesthesia. The majority of the time, that's really not necessary. That's really not necessary. And even the doctors who do that say it's not necessary, but sometimes patients say, well, I'd rather be put to sleep. I don't want to know anything. So.
Now, one of the reasons I wanted to bring you on the show, because people need to know how it's normally done. And I think I have a little bit of an understanding from talking to you, and we've had you on the show before. But normally when people are in pain, their primary care physician manages maybe the medication or whatever, and maybe they're not as aggressive as they can be because that's not all they do. They're not there to monitor pain, and they should.
Well, primary care doctors, there are a lot of changes in blood pressure medicines, antibiotics, any number of other medical problems. Pain management physicians specialize in just pain management. So, the best techniques, the best medications, the best choices, and they may be subtle. You might say, well, what's the difference between a Percocet or Vicodin? But they may make a difference for the patient in terms of outcome. And that's really what we're looking for is best return to function with the least impact on the patient's life.
Okay, so the other thing is, even if you have an HMO or if you have a PPO or Medicare or whatever, you don't have to sit around waiting for a referral most of the time. You could go directly to the pain management physician. Is that correct?
Well, it depends on where you live. If you're in an HMO, you probably do have to go through that referral process.
But if it's a PPO, you can go.
But a PPO, you typically can go to the doctor of your choice. And I think, there are some pain clinics, though, that insist on a referral from an outside doctor.
Okay.
And, there's certainly some good reasons for that.
But one of the points that I think that I know you wanted to make was that the public needs to know what to ask for in their pain management physician. Because of reimbursement, and this is another topic, many people are jumping into what you're doing, right? A lot of physical medicine doctors, things like that, are dabbling in pain management or breaking into it. And I don't want to put words in your mouth, but you might, if you're going to go to a pain management physician, and I think you told me this before, ask if they are board certified in pain management.
Well,
is that right? And it doesn't cost more to go to that.
No, it doesn't. It doesn't. And board certification essentially guarantees you, it's a stamp of certification that you have knowledge in treating those conditions, and it is a separate board certification. A lot of people may put board certified. We'll make sure that they're board certified in pain management. For instance, I'm board certified in anesthesia and board certified in pain management. If I was board certified just in anesthesia, that doesn't really make me a pain management doctor. There's a whole different knowledge base and application of medications.
So even if you go to a hospital, you want to make sure, because they may have non-board certified guys doing your pain management.
Well,
right.
I mean,
non-board certified in pain management is what I'm saying.
Right. Just the same as
they may be qualified, but you're saying that you might as well ask.
Well, you should ask questions. You want to make sure that
they're boarded. Now, the other thing that we learned today, because I've interviewed you on another segment, is that if you're an independent, for example, you have an accredited, I guess, surgical center, things like that, that it's less to go to an independent as far as copay, out-of-pocket copay, even if you have insurance, than it is if you go to a hospital.
Hospitals.
Is that true?
Hospitals do, I mean...
Not to put down hospitals, but I'm saying, isn't that true?
And hospitals, do a wonderful job, and we need hospitals. But the cost and the reimbursement that's allowed by insurances and Medicare and so on is higher. So if you have a copay 20% or whatnot, your cost is going to be higher. And that's true whether whether it's a hospital and a hospital-based or a physician foundation-based
So if
group
the
that's
hospital
owned by the
owns, so
hospital.
if the hospital owns it, insurance will have to pay more or will pay more. So because of that, you have to pay more by going to a hospital.
If
out
the
of
hospital
pocket.
owns
Is that how-
if the hospital owns a facility, and then the facility may be virtually the physician's office, so maybe even your office visits are going to cost more money.
Okay, so let's just suppose. Let's take an epidural, right?
Correct.
Or yeah, an injection. Okay, if it's common three office visits, it may be like $50 extra for every visit. So that's $150 out of your copay, out of your pocket, more just because you went to a board-certified pain management physician at a hospital.
Right. Well,
that true?
The cost, right? The facility fee may be $250 to sometimes I've heard $400. So for every office visit, you incur that charge, and then you're going to be responsible for 20% of that. So if you're going to a hospital-owned facility, your costs are going to be higher compared to an independent.
So and all that matters to somebody that has insurance. Okay, they want to get out of pain. They know that they need an injection, right?
Correct.
And so if they go to the hospital, great service, great, effective treatment, but it's going to cost out of pocket potentially $150 to $500 more for 3 treatments out of pocket than it would be if they find an independent board-certified pain management physician. Is that true?
That's correct.
Interesting. And most people don't know that?
I don't think the public's aware of that because you go, well, my insurance covered it. You really don't have an idea of what things should cost.
And here's my other question. So for example, if you go to an orthopedic surgeon that's owned by the hospital, that means that group, they're going to refer to that hospital for pain management, usually.
Correct. Well, and that's actually been found out that hospitals have been encouraged in the recent past few years to buy practices. Now in California, a hospital per se can't own it, but they usually set up an outside foundation. Well, they're finding certainly that the cost, because typically there's a pressure to refer back into the hospital. Well, everything at the hospital is paid at a higher rate. And again, we need hospitals, and there may be things where they lose money, and so the government and insurances allow them higher rates.
Well, the main thing though is
and so the cost though to you out of your own pocket is going to cost you more money.
Because when you told me it costs more to the hospital, when you initially told me this earlier today, I thought, well, who cares if insurance is paying for it? But you're saying the copay is more out of their pocket.
Right. The copay is yours, and then when people say, well, my insurance covers it, I say, well, what happens to your premiums the next year? So if you're incurring, if you have private insurance and you spend a lot of money, well, your rates are going to go up, and so all of that drives costs.
There's 2 main points today, and we're out of time. If you're in pain, ask your primary care physician. If it's not working out, I want to be referred to a board-certified pain management physician, right? Is that
Correct.
right?
Well,
and if you're going to go, it's going to be less expensive out of pocket as far as copay, even if you have insurance, if you go to an independently owned.
Typically, you can go to a freestanding surgical center, and that's true across the board, whether it's MRI imaging, laboratory testing, whatnot. The cost is less in independent
I interview
centers.
a lot of medical doctors. I've never heard this. How come I haven't heard this before? I hope this is accurate, by the way.
It is.
This
It's
is you
absolutely
saying
true.
this, not me, by the way. Okay,
Absolutely
so that's
true.
true. Well, Dr. Reinhart, always a pleasure to have you on the show. Very
Well, thank
interesting.
you.
Thank you.
Thank you very much.
You've been watching the Wellness Hour. We'll be right back.